Good morning, Jamie, and good afternoon from my part. Welcome. I'm really looking forward to getting into this topic of telehealth. It's very close to my heart, and I think it's revolutionizing the whole clinical area of how we deliver healthcare to patients.
Yeah, absolutely. Nick, it's a pleasure to be here with you. And clearly, we couldn't be discussing a more relevant subject today in the healthcare world than telemedicine and where it's been and where it's going. So I'm looking forward to this. This one will be fun.
Exactly. For some people who may be joining us now, we will begin in about 3 minutes, maybe 3 to 4 minutes. To make sure that we get a sizable audience. Again, thank you for your patience. So I see you're in California.
El Segundo, California is where my office is. I live in Santa Monica, and I'm originally from Buffalo, New York, though. So Buffalo is a big part of my
Yes.
background and heritage. So I'm a Bills fan and a Sabres fan. And a big chicken wing fan as well, Nick. So that's part of the diet that's kind of stuck around, probably maybe unfortunately
Yeah.
for me, but fortunately because Buffalo is a great place to be from. It's really a wonderful community.
Oh, it is. It is. I'm next door east to you from Rochester, but
Yeah, fellow upstate New Yorker.
you
Although we're like
got it.
Western New Yorkers, right? We're like Western New Yorkers, not
Western
necessarily
New
New Yorkers.
Yorkers,
Yeah.
or maybe the forgotten part of New York. Okay, in about one more minute, I see we have people joining us. Again, Jamie, thank you for your patience and time today.
Oh no, this will be great, and looks like we've got a lot of people in attendance. So looking forward to the Q&A session afterwards, and seeing what's on everybody's minds.
Okay, yeah. Okay, so let us begin right now. First of all, I want to welcome everybody who's attending this webinar on telehealth, which is a whole new area, if you could say it, in terms of a discipline in how we deliver services remotely to patients, and which again, it's becoming the new normal, quote, particularly since we're in this quote COVID-19 arena. And so with that, I would like to introduce our host. Good day to everyone, and I'm Nick from OSP, and welcome to our webinar. So let me begin. Everyone is talking about a new normal in a pre-COVID and post-COVID world. That's true. There's no doubt that COVID-19 has affected us physically, emotionally, and economically. People and businesses are trying to get back on their feet, but there is a lot of uncertainty about the future of every industry. So in our last webinar, we spoke about the staffing challenges in healthcare. Today, we are delighted to have Jamey Edwards, a Healthcare Information and Management Systems Society digital expert for 2020, and the CEO of Cloudbreak Health, to talk about another widely discussed topic, telehealth. So in healthcare, COVID-19 has brought telehealth to the forefront, and there are varied opinions in the healthcare community. And may I say that has driven a lot of changes in information technology and how we approach clinical institutions and medical research in terms of the exact technologies they will need to deliver remote healthcare. So today, let us hear Jamey's views and insights about telehealth as a new normal for delivering healthcare and clinical services to patients remotely. As a visionary and innovator of telehealth solutions, we will gain a very deep and practical understanding from Jamey's insights into how care coordination has changed since this crisis and what the future of virtual healthcare will look like and the value it will bring to patients. And so again, welcome to the webinar, everyone. And Jamey, thank you for joining us today.
Thank you for having me, Nick. I'm really looking forward to this.
Thank you again. So let's begin with the first question. I know it's been a while, but all the same, congratulations since we last talked on being selected as a digital innovator and healthcare change maker for 2020. So could you tell us about your experiences as a member of this groundbreaking inaugural group, which is again the Healthcare Information and Management System Society?
Yeah, HIMSS, as we like to call it, kind of anecdotally, right? It's our slang name for the Health Information Management System Society, is one of the largest organizations in terms of pushing progress forward in healthcare when it comes to technology and innovation. And the HIMSS conference every year is the largest gathering of people in the United States who are trying to really address the issues that are facing healthcare. And I was so honored to have been selected for this digital influencer program, digital expertise program, because the theme of it was all around being the change that you wanted to see in the healthcare system. And so that hashtag
Mhm.
be the change was a key part of it. And it's a super interesting year from a COVID perspective to be a digital influencer for a conference when the conference went virtual and was suffering from a lot of the same issues that we as a broader population were suffering from. But Michael Gaspar, who runs the digital influencer program at HIMSS, done an incredible job of bringing together people from all different walks of life in healthcare, from Rasu Shrestha and Geeta Nayar and Legia Riccardi, to people who represented the patient perspective, like
Mhm.
Stacy Hurt and Jen Horonjeff, and a few other folks as well. And I learned from every single one of them. And that was the key part of the program for me was, these are other leaders who
Mhm.
were doing their thing in their respective sectors of the industry. And it was fascinating for
Mhm.
me to be able to take all those perspectives in, take a step back and actually think about the industry from a different perspective. And so it was really a wonderful experience, and it's still ongoing today.
Mhm.
There's some really tremendous programming that HIMSS has put out on how to handle digital innovation, how to handle these transformative times when it comes to COVID. But it's been interesting to see not only the conference shift to digital, as healthcare has shifted to digital. And that's been a really cool process to be a part of.
Exactly. Do you think, as a precursor to the current crisis we're in with COVID-19, um, historically, for the past couple of years, our whole healthcare, or maybe for the past 5 to 6 years, it's been shrinking in terms of the availability of clinical facilities, even physicians. So it's been shrinking, and you see a lot of clinical institutions. They've been merging, for instance, in other industries, they merged as subsidiaries, and so they've shrunk. So, do you feel, coupled with that and COVID-19, and of course the changes in technology, that has put the telehealth up front and center to everybody's view?
Yeah, look, if you take a look at the trends in the healthcare industry over the last few years, there have been more hospitals closing than opening. It has been harder and harder to get an appointment with your primary care provider, whoever it might be. And so, we have this access issue. And so how do you solve that access issue? And look,
Hmm.
telemedicine really has been around for 30 plus years, right?
Excellent
From
point.
starting off with the phone, which was, hey, pick up the phone. We all call that telemedicine 1.0, is using the phone, this ubiquitous technology that's everywhere, right, at
Exactly.
everyone's fingertips. Um, but yeah, COVID has definitely accelerated what I would say digital, healthcare's digital transformation, which really has been lagging other industries. If you compare us to,
Hmm.
most other industry verticals, healthcare is just behind from that perspective. And so COVID has absolutely accelerated that from a digital transformation standpoint. And we're a member of Startup Health, and Startup Health is one of the largest technology
Hmm.
incubators in the United States and accelerators. And we talk about a lot with them kind of what the different moonshots are. And one of the moonshots is increasing access. And that's an area where Cloudbreak, my company, spends a lot of its time, is how do we resolve healthcare disparities? How do we put the healthcare industry at our patients' fingertips and the people who really need to use it. So that's been a big push, and yeah, it's absolutely driven by, telemedicine.
Yeah, it's just been phenomenal how now telehealth has moved front and center, but there were so many enablers to make that happen. Uh, so it's just phenomenal. Uh, Another pain point for most providers is patient compliance, appointment, no shows, prescription management, which is very big, and adherence to treatment plans. Have you ever seen any improvement in patient compliance through the use of telehealth?
Yeah, the answer is yes. You talked about healthcare, being, kind of the hospital being front and center, and now digital is front and center, and we're now
Hmm.
referring to that as the digital front door, right, of the healthcare
Hmm.
system, because it seems to be a more convenient, cost-effective way to actually let people access their healthcare, and then you can escalate to that in-person
Hmm.
visit. And, telemedicine's not a panacea in front of it in its own right. It is part of a broader set of tools that the healthcare system can now, surround a patient with their continuum of care with. So from a compliance and convenience perspective, those two things are very linked. If you really think about it, it's the easier something is, the more
Hmm.
likely someone is to do it.
Oh,
And
exactly.
so telemedicine has made it easier to access healthcare, and without the added factors of travel and parking and going to sit in the waiting room, appointment no-shows are definitely down. And patients being able to be seen from places where they're intrinsically satisfied, their home or their work, and most of us walking around with a smartphone in our pockets, that can help us,
Exactly.
that can remind us when to take our meds, or that can walk us through really engaging patient content when normally we'd be sitting in a waiting room. Patient compliance is definitely a sector where key measures are on their way to a big improvement.
Oh, yes. I mean, when you take a look at the certain mobile devices that are being used, where if there's this one mobile device, if I'm able to use my fingers, it's able to tell me my blood pressure, my heartbeat or rate. It's just amazing that now the mobile devices have made telehealth more synchronous two-way instead of just bi-directional, or instead of async rather.
Yeah, yeah, and look, there's a spot for both modalities in telemedicine, whether it's async or synchronous. Really great
Hmm.
telemedicine platforms, quite frankly, are going to integrate both. If you think about what asynchronous technologies look like, their email, their chat, their file and
Yes,
image sharing, and they really allow you to time shift care almost the same way a DVR time shifts how we watch TV, right?
exactly.
That doctor can take a look at a bunch of photos that the patient has sent them at the end of the day and go through and say, yeah, this looks good. No, I'd like to see you on this. Let's schedule an appointment tomorrow. So it's all about how we slot these digital tools in to what is a better workflow for the entire healthcare system.
Exactly. What the end result is, if I can expedite some sort of plan for the patient or intersect a potential problem. I mean, take a look at some of the procedures that used to be uh, in hospital procedures. Now the pharmaceutical firms have come out with certain technologies, certain
Yeah.
prescriptions. You could expedite that. But thank you, Jamey, for your response. So many clients come to us looking to integrate telehealth and with their existing systems. Does the integration of telehealth with other systems, such as electronic health records, also known as electronic medical records, RPM, help in getting better insights into creating personalized care for patients as opposed to a in-person visit?
Yeah. So Nick, I love this question because one of the key things that it focuses on is interoperability, right? Interoperability at its core is going to be the way to fix our healthcare system, is by getting a bunch of disparate systems, not only
Hmm.
technology systems, but health systems, to collaborate with each other around a patient. And it remains the holy grail when it comes to healthcare, and therefore telemedicine platforms are really no different. The telemedicine platforms that these hospitals are looking at, they need to be thinking about interoperability and how they're going to interface with the electronic medical record, and then how you're going to bring in tools from the outside, like remote patient monitoring tools, whether it's a blood glucose, glucometer, heart rate, blood pressure, whatever it might be, into one, again, unified solution and workflow. And the key thing is hospitals really don't want to maintain multiple point solutions if they can avoid it, because it's more for that IT group to monitor. And so they want to go with almost a one-stop shop, or one throat to choke, they sometimes call it in the industry, right? When it comes to partnering with a company that can provide what is a seamless experience for their patients, where they aren't hopping from platform to platform to platform. So a different telemedicine platform for inpatient than they would use for home health. These health systems really want to be able to bring their entire healthcare system to bear around a patient. So, we believe the market's moving quickly towards enterprise solutions that really integrate with the EMR and RPM tools, as you mentioned, all with customized branding, customized workflows, so that the technology molds itself to that specific healthcare system strategy, right? That's important. You don't want to go with a system that is commoditizing the doctor. Doctors have worked really hard to develop their work methodologies, and we're really paying for a share of their mind and their ability to diagnose us when they're treating us, as well as the ability to put hands on body, right, eventually. But and do something procedural. So, when I take a look at the system, you really want to find a platform that molds to your strategy and that doesn't commoditize that doctor. So our goal at Cloudbreak, we try and surround a patient with their care team, not just from a single system, but to be able to do that across systems. So imagine that eventually you end up with what we would call a precision care team, where you have a patient who has multiple comorbidities or chronic conditions, and cardiologist from NYU, an oncologist from Mayo, and a dietitian and internist from whatever their local healthcare system is, really giving them the exact care that they need with the exact experts that they needed to actually perform that care. And that, for us, is where the future of all this is really going.
Exactly. Instead of waiting for a referral, you're able, with telehealth, you're able to get the experts more readily together.
Correct. And I think the amazing thing about it, Nick, is when we take a look at the healthcare system, especially here in the United States, I know we're on a very international call. Some countries do this better than the United States.
Yes.
The tech is not the problem, right? It's the culture of our healthcare system, and it's changing basic human behavior and bringing people in. So a lot of the times it's not the technology that's the big issue.
Excellent. No. I cannot agree with my own experience working in healthcare. In many cases, it's been with the merging of these clinical institutions, they found themselves with multiple EMR systems, off to the side systems where another group did this and there was no visibility. But now I think the whole notion of an enterprise solution, I think digital transformation is driving that. And this whole need to have interoperability, that's why I think the clearinghouses do a great job, but I think the cloud is also a supporter of telehealth.
Absolutely. Absolutely. And the cloud, as more and more migrates to the cloud, that interoperability issue should become easier and easier to solve.
Exactly. Let me just, well, going off on a tangent, ask one question. The traditional communications has been HL7 message. Okay. If telehealth is being conducted, I think maybe there may be a new structured record using AI capability to basically take this information that's been shared via telehealth and to be able to structure a new patient record.
Yeah, it's so interesting because my view of the patient record is it should be owned by the patient, and then the patient should grant access to a provider and say, please document this instance in my patient record. That's where I'd love to see things going, because it's still too hard for patients to get the information they want from doctor to doctor to doctor. So, there are a few companies out there that are trying to solve that problem, but it's definitely one that needs to be solved.
Yeah, I bring it up because data governance is a big issue. I mean, data integrity and then the governance. Jamey, thank you. So I heard one of your talks. I listened to one of your talks where you mentioned that telehealth helps in measurement and hence better management of data. Could you elaborate on that? I know this is a good segue into the governance aspect.
Sure. Well, I mean, the cool thing about telemedicine is that it's digital in its structure, right? So by its very nature, they can be measured. We've got the start time and stop time of calls. We have the duration of calls. We have who was on the call. To your point, we can even record the calls, layer AI over the top of them, and then have it pick out key metadata that says what
Excellent.
happened during that call, and to measure that
Mhm.
call for quality, and to find out why one doctor might say, well, you have congestive heart failure and this is how I want to treat it, versus another doctor says you have congestive heart failure and this is what I think you should do, and then compare those results, right? So that is the cool thing about all these digital health tools that will be rolling out. And it's important when we define telemedicine. Telemedicine's not just a video call. It's not just an audio call. It's AI, it's chatbots, it's remote patient monitoring. It encompasses a whole
Exactly.
slew of different modalities. And, I went to business school, and in business school, we always talked about Peter Drucker, who's a management guru. And he always said, what gets measured gets managed. And so the key now, as I
Great
think
point.
we've discovered, is that there's a ton of big data out there, but
Hmm.
how do we make it small again? How do we take these big pools of data, these data lakes that are out there, and make the information
Excellent.
digestible so that people can drive an insight, have that insight drive an action, be able to measure that action's impact in what would be a cycle of
Hmm.
continuous improvement? I mean, that's really where we want to get to.
Yes, and it isn't just data, it's also a multivariant type of content as we move into
Yes.
quote the analytics area. Before we continue, I would like to say to everybody, I forgot to mention that 15 minutes to the hour, we will go to question and answers because I see we have some in the Q&A as well as chat. So thank you for your eagerness to put forth questions. Uh, so, Jamey, Cloudbreak Health has pioneered many industry firsts. You're the first company to bring a certified medical language interpreter into a video telemedicine call. One of the first companies to follow the patient from home to the hospital and back again, enabling a patient's existing continuum of care with telemedicine. Could you tell us a little about that? And before you begin, it almost sounds like a drawback, without dating myself, in the 50s and 60s when the physician, like Dr. Welby, a TV series in the early 70s, would make the visit to your home. It,
Yeah.
it it's it almost sounds like you've taken it back, but in a digital aspect. You've taken it back to that time.
Yeah, well, I think that's definitely the case. I think we're going to end up in a situation, in the next 20, 30 years where everyone's going to have digital health tools in their home. They're going to be ubiquitous.
Hmm.
And when you call your doctor, it's going to be, hey, strap on this armband that like measures all of your vitals, does everything you want, and they're going to
Hmm.
be able to remotely, do a lot of things. And you're going to be able to actually do even more procedures remotely, depending on, the capabilities at that point in time. But innovation for us is a key part of who we are as a business and company. And so we
Hmm.
take a lot of pride in really doing things that push the industry forward from a thought leadership standpoint and from a service level standpoint. And we're never really satisfied with kind of sitting on our laurels and, sitting on
Exactly.
this existing base of services that we have, because the industry is moving so fast that if you do that, you're going to become irrelevant pretty quickly. So we're always thinking about how we can help
Hmm.
address healthcare disparities and increase access to our healthcare system. And COVID was a great catalyst for us and helped really accelerate our product roadmap. It didn't necessarily add any revenue to the business per se, but what it did was it allowed us the opportunity to really collaborate with our partners and solve their issues. And a key part of our mission as a business is to
Hmm.
humanize healthcare and restore the joy of calling back to providers, because we think if we do that, we are going to, those providers will therefore feel like their work is more meaningful. They'll take better care of patients. And so one of the things that we did during COVID was, in 3 weeks, we ended up turning around a new app called Telequarantine. It was the first
Oh,
telequarantine app in market. We offered it for free to the market during COVID, and the whole goal was to protect frontline healthcare workers, lower their risk of contagion, and reduce
hmm,
their use of PPE, which is a very scarce resource for
yes.
a while, and still is. right? And
Mhm.
what it basically allowed them to do is take our language services platform, roll it into the room, turn that room into a
Mhm.
connected care room, and allow the doctor not to have to go into the room to round on the patient. They could call in from outside the room. The patient could call the doctor from inside the room. And it also helped solve a big problem, which was patient isolation. So the patient could actually call from home, call their home or call a family member in a HIPAA compliant
Mhm.
fashion from that room as well. So we were pretty proud of being able to turn those types of
Excellent technology.
innovations into market in a really short period of time. And we also realized as a business that we didn't have a real virtual visit platform that was productized and launched, even though we had worked on one. So we made sure that we accelerated that time frame, moved quickly to bring it to market so that we could have a whole suite of services that followed the patient from home to the hospital and back again, but on a single platform.
Exactly. Going back to that example I gave with the 50s and 60s, where there was a personal connection. I think telehealth has brought back that personal connection instead of you driving down to the clinical institution, you're in a waiting room. There's this sort of one-to-one connection. It's human to human. And it's been my experience just using telehealth as a consumer where I take to heart more the advice of the physician or physician's assistant because it's like us having coffee
Yeah,
at
and Nick,
Starbucks, say.
the super interesting thing about what you're saying is there's been some studies on this. Their studies have shown that people are more honest with an AI than they are with a doctor in the room, right? And you
Exactly.
think about that for a second, right? And it's because we as human beings have this fear of judgment. And
Hmm.
when we're in the room with someone, we're afraid of what that reaction looks like. But that little bit of distance that telemedicine brings can help you be more honest with the provider because you're not worried about seeing them necessarily at your local supermarket. And for some reason, that screen, you can still have a very intimate experience in terms of that, but someone, you can also have this little barrier that helps create a little bit more honesty. And that's counterintuitive. So yeah, a lot
Exactly.
of people have really discovered that, from that standpoint, telemedicine in certain instances, right? The gold standard now in healthcare doesn't have to be that in-person visit. The gold standard is the appropriate modality for the appropriate condition of that patient. So in certain
Hmm.
instances, that's going to be in person, but in other instances, it's going to be that telemedicine phone call, it's going to be the chat, it's going to be that video call that you can do with your provider.
Yeah, it's also changing how in America we view, quote, a person from the clinical side, a patient, rather than a customer. So I think telehealth has
Yep.
promoted more of a CRM, customer relationship management perspective, and it's very interesting. In the year 2000, when I was with Lockheed Martin, I basically was in charge of deploying a CRM for National
Yep.
Healthcare Service in Britain, and I wondered, wait a minute, in America we don't see patients as customers. So I think telehealth has really changed that paradigm.
Yeah, I couldn't agree with you more. We've seen a lot lately on the consumerization of healthcare.
Hmm.
And the people are really struggling with this patient versus consumer or patient versus
Yeah.
customer definition. But whatever you want to call it, the fact is that it's getting easier and easier for the patient to be more engaged in their care, take more control of their care,
Yes.
and as a result of that, vote with their fingers instead of their feet when it comes to selecting who they want their healthcare provider to be. And as all those barriers start to break down, treating, being worried about patient experience is going to be a key part of what health systems need to focus on delivering.
Excellent. I could not agree with you more, Jamie. So the next question, so reports show that in 2019, only 1 in 10 Americans used a telehealth service. While telemedicine has been around for over 20 years or 30, as you said, what were the reasons you think providers and patients stayed away from telehealth until the current pandemic? And I know we spoke about the enablers, drivers up front, but I'll let you elaborate more. Thank you, Jamie.
Yeah, no, great question again, Nick. And this one's pretty simple for me. We have a healthcare system, at least in this country, that's really been built around, and the whole infrastructure is structured around this in-person visit. Reimbursement is built based around the in-person visit. The way hospitals were built around the in-person visit. So we haven't built a digital first healthcare system in this country. And that's why it's taken so long for us to even get to the point where we are. It was designed from the ground up to be, how do we get people into a bed or into an office? So many of the issues, as I discussed before, our healthcare system faces aren't a certain technology not existing. It's really centered around the culture of the health system and its structure that won't allow tech to be deployed due to the competitive environment, regulations, or simply what we're used to as humans. And if you really think about it, the medical education system and the thousands and thousands, hundreds of thousands of doctors we have in the country, they were trained around the in-person visit and not trained
Excellent
around
point.
digital.
Yeah.
So there needs to be a lot of change management that needs to occur to get people to say, hey, instead of you coming in, why don't we do this visit over telemed? Now, the cool thing is, I think doctors have built a ton of muscle memory and patients have built a lot of muscle memory now because of COVID, with how convenient digital health platforms can be, with how it can improve the practice. So I think from that standpoint, that again, catalyzing the digital health transformation that we're seeing and that's underway. But we really need to still think about what we're going to do from a payment system standpoint. And the one example that I bring up that really resonates with people is if you take a look at Kaiser here in our country or the VA
Yes.
health system, which are closed-end systems,
Yeah.
both of those systems do north of 50% of their visits over telemedicine. So what
I
does
was
that
going to
tell you,
say that the
right?
VA has been a champion.
Yeah, super innovative at the VA and what Kaiser are doing. But it tells us that when you can control the patient experience from end to end and you offer them tools that actually make their lives easier, they're going to opt for those tools instead of that in-person visit. And that health system thereby is going to save money, increase coordination, increase quality, and do all those different types
Yes.
of things.
No, I could not agree with you more, Jamey. The next question, to establish telehealth as a new normal, what kind of HIPAA compliant cloud software and infrastructure will hospitals and providers need to make a switch to telehealth consultations? And let me just add something onto it too. Many clinical institutions, from my own experience, you will find legacy systems going back to the 1970s, particularly the 80s with the old digital computer-based company that insured medical services. So do you think it's possible that the changes that sort of enable telehealth to come to the forefront would also be the enabler to make these institutions change and invest in new technology and retire legacy technology?
Absolutely. I don't think if you're a health system today or a hospital and you're not thinking about your digital front door and how you're going to integrate digital health tools, well, again, patients can vote with their fingers, which will result them voting with their feet, and you will lose market share to those that are thinking about these technologies and how they can make patient and providers' lives better. I think what we saw during COVID was that a lot of hospitals, because they wanted to offer these telemedicine services, were making platform decisions that were Mr. Right Now instead of Mr. Right, or Mrs. Right Now instead of Mrs. Right. And I think what we're going to see is a second wave of platform decisions where people said, you know what, the platform that we selected isn't interoperable, doesn't integrate language services, doesn't do X, Y, and Z. And so we really want to be with a provider that can do all of those different things. And so I think what we're going to see is the evolution of the platform, not the point solution, that really brings the full weight of a healthcare system to bear around their patient. And as a result, we spoke about this before, but interoperability will be key. And so, the advice is go for platform, think interoperable, think about a solution that can, again, mold to your workflows, not commoditize you as a healthcare system, and that really becomes your platform as a healthcare system, not a platform you bought from someone else, but really becomes yours and part of a strategic advantage in market.
Yeah, and I think based upon my own experience, the whole notion of enterprise architecture, digital architecture is driving the recognition to people in clinical care. You need an overarching enterprise architecture approach that would help them retire legacy, modernize, and embrace the technologies for telehealth that a company like yours, would bring to them.
Absolutely. Absolutely. We're seeing a lot of folks who have had systems in place for 5, 10, 15 years that they're finally getting around to retiring because the new technologies are simply that much of a leap forward in terms of what the capabilities of the platforms are.
Yeah, and going back to this one-on-one personal, um, and the patient feeling that they have, or the customer rather, feeling they have more, quote, skin in the game. There's this
Mhm.
personal connection. Do you feel that it helps to establish a better means of communications? This is telehealth, and give the customer slash patient the feeling that the medical providers uh, shows, establishes an emotional context with the patient. Is
The
it
answer is, yeah, the answer is, Nick, definitely, right? Communication is the number one diagnostic tool a clinician has and the number one empowerment tool that a patient has. And it can definitely, communication can be improved and be done virtually. And when we take a look at how we're training people these days, we almost refer to it as digital empathy, right? And in the telemedicine space, you'll hear it referred to as webside manner. There's a lot
yes,
of
yes.
different skills that we need to train our clinical teams on how to convey that empathy over video, over the phone, whatever it might be. And that's a new ball game for a lot of clinicians that are out there now.
Mhm.
Do we not understand that you can feel the love of your kids over FaceTime, even though you're not geographically in the same place? Of course you can. We spoke about the fact that distance sometimes creates honesty and less fear of judgment. And
Excellent.
we know
Yeah.
that like different telemedicine services like telehospice, companies like Resolution Care that are out there, are happening today, and that solutions like our telequarantine solution help reduce the feelings of patient isolation. So we know that the technology can actually enable a better emotional experience, but it's important that the
So true.
person on the other end of that camera conveys that appropriate emotion as well, right?
Exactly. It's that old-fashioned bedtime manner
There you go.
that they spoke of. So, Jamey, you've been giving us a set of great insights. So again, thank you for doing this. Um, Next question. Statistics clearly show that the pandemic has um, affected African Americans, Hispanic Americans more readily. So, healthcare professionals attribute this high ratio to a very fragmented and unequal healthcare system. Do you agree? And how do you think telehealth can help reduce this disparity?
Yeah, well, look, I mean, this area is an area where it's a point of focus for our company. We, started off bringing language interpreters to the point of care and trying to resolve that healthcare disparity and make sure that these LEP and deaf patients could receive the same standard of care as their English-speaking counterpart. And it's that solution that launched us into 1,500 hospitals across the country on over 10,000 video endpoints, doing, 85,000 encounters a month. So
Yeah.
this is near and dear to our hearts. What I would tell you is that we're living in a situation in a society where unfortunately many of the populations that you mentioned are heavily affected by what we call social determinants of health, and they don't
Great
have,
point.
they're living in urban environments in close quarters without access to preventive care or easy social distancing. And so as a
Hmm.
result, they have a disparate effect, a disproportional effect and impact when it comes to things like COVID. And these are, issues that we could solve using
Yeah.
telemedicine by bringing resources into these communities that allow them to address their needs. That could be bringing dietitians in. It could be bringing in more urgent care and primary
Hmm.
care via telemed and giving access to these apps for these communities. But it's definitely the case that there's still healthcare
Hmm.
disparities, and it's interesting. There's some articles that have been written on the fact that if we have disparities in our society and then we launch a digital platform, that those same biases and those same issues are going to be reflected in that digital platform instead of resolving them. And so we are
Excellent
very
point. Yes.
conscious,
Very valid.
right, of the fact that if you have a bias and that bias makes its way into the AI that's analyzing the data because the data was inherently biased, then the AI is going to be biased.
It will pick
So
it up automatically. It will flag it.
automatically, right? Automagically, as some people say. So it's one of these situations where we're very conscious of that, and we make sure that when we're designing product and systems and solutions to go into market, that we are compensating for any of those biases as they exist.
Yeah, yeah. The only juggernaut I see potentially is that if we do go with a national healthcare model, uh, I think technology, it would be a good driver to drive them, but the question is, how fast does does federal government move and states?
Yeah, well, look, I think one of the great things that's happened throughout COVID is that we've knocked down a lot of the barriers to telemedicine. We've knocked
Yes,
down, medical licensing, doctor being able to practice across state lines. We've attacked some of the reimbursement issues and
yes,
parity states and those types of things. Now, not all that stuff is permanent. Some of it needs to be made permanent because what
exactly.
healthcare, what telemedicine can really do is load balance the healthcare system, right? So in
Hmm.
communities that have shortages of doctors, we can go to communities that have significant doctor populations and then beam those doctors in, right? We can load balance the healthcare system in that way. And I think
Exactly.
that's where things need to be going. We need to continually be looking to how we can drive forward in resolving these disparities.
Exactly. So the last question, Jamie, the security of patient health information, PHI, has always been a challenge in healthcare. In the recent breach of a telehealth application, which is Babylon Health, has raised a host of privacy concerns about telehealth apps. Do you see this negative? Has this impacted, from a negative perspective, the adoption of telehealth applications?
Look, I think for a long time, as technology has started to permeate our society, that we have traded privacy for convenience every day in what is a
Yeah.
digitally connected world. I've had my credit card stolen a number of times over the last few years. It's simply
I
become a
feel your
part of
pain.
life. Yeah, it's
Yes,
simply become a part of life. And, thank God that, credit card companies and healthcare systems and whoever else, is handling this data. They have ways to, help you protect your identity and whatever it might be. I still, and I mentioned this before, I think PHI needs to rest under the control of the patient and not in the hands of the hospital or an EMR
hmm,
company. I'd love to see a situation where, patients grant access to their records to those treating them instead of having such a difficult time accessing their own data. And maybe, look, we understand that sometimes this information is going to get hacked. Healthcare is one of the number one venues for hackers these days.
exactly.
There are people attacking our servers and every healthcare system servers every day trying to get in and get information. So we have all the right approaches in place in order to stem that from happening, but it's not going to stop, and hackers are going to continue to get creative when the fact of the matter is that a
Exactly.
medical record is worth 10 times what a social security number is worth on the black market. So
Exactly.
I don't think it's going to be a primary reason that will stand in the way of telemed. I just think it's something that we need to take into account, always be looking to enhance security, always be looking to protect this information. But I don't think it's a primary driver like reimbursement, convenience, and broader culture change.
Let me just ask you just one quick question. We only have about a couple of minutes before we switch to the questions and answer session.
Sure.
Where do you see, and I have some ideas myself, we know that telehealth is enabling for better care, to expedite care and so on, and to level set in terms of having enough physicians and so on. What about related or supportive types of areas like the supply chain of medical equipment, of working with pharmaceutical firms to expedite? For instance, if we came out with a vaccine that was approved and tested through FDA trials for COVID-19, what's the impact telehealth would have in terms of moving these two areas closer to the patients as well? I mean, to
Yeah,
customers as well.
Great questions, right? Are there virtual clinical trials that can be done? There are a lot of companies that are working in that space right now. From a supply chain perspective, I think we need to tweak supply chain's focus a little bit away from cost savings and towards creating
Yes.
value, right? As we move towards a
Excellent.
value-based healthcare system, how can supply chain help in bringing in vendors and partners to hospitals that are helping create value and not just save costs? Difficult thing to do during COVID when health system volumes are down overall. So I think it's going to take some time, but to me, that's a big mindset change that should happen. But telemedicine, we're looking forward to the day where it's not telemedicine or telehealth anymore. It's just healthcare and medicine. When someone is using a stethoscope, do you ever hear
Exactly.
someone say, "Hey, you're practicing stethoscope medicine right now"? No, it's part of the doctor visit. So we're just hoping that people understand that all of these digital tools are just really the digital transformation of healthcare, and that they are going to become integrated into the daily practice of care, and into the daily practice of how people surround care. Can they be used for training nurses? Can they be used for coaching staff
Hmm.
that's on the front lines? All these same technologies can be used and integrated for that. And the more integrated they become, the more value they're going to give.
Yeah, yeah, which to me, they would be uh, nothing but tool sets that a doctor would have put in the old days in his
The
medicine
medical
bag,
bag. Yeah,
or
exactly.
like the mechanic at Firestone. I have my toolkit. I'm just
Right.
adding more tools to help me. Jamey, this has really been an eye opener. So again, thank you. So let's switch to the question and answers. So we will go to the Q&A, and our first question is from Jonathan Wiseman. Patient-centered healthcare for data access and control. Are we still in the focus of making the patient-centered healthcare important, not just provider-controlled? Patient-controlled have a place in the market, speaking to combining all data across personal and EMR, access via blockchain and AI with machine learning for creating patient value. So what are your thoughts? That
Yeah,
was
look, we've hit this a little bit, but I definitely think the patient should be in control of their data. I think what we need to have is stakeholder-centered healthcare, and that takes into
Mhm.
account what the patient needs. It takes into account how the provider wants to provide the care, but the data to me should really reside with the patient. And definitely blockchain and AI, and again, a number of companies working on this that are out there, but no one's solved it yet. It's going to take not just companies with technology that work. It's going to take
Mhm.
breaking down barriers between healthcare systems who are saying, you know what, this data is not really mine, and being okay with saying that it
Those
really
those
belongs to the
cultural
patient.
barriers.
it's
Yeah,
a
yeah.
cultural it's a cultural and organizational barrier more than it's a technology issue right now.
Excellent, excellent answer. The next question comes from Jason Karp. He said, "How is the health information and management system society and other telehealth technical professionals looking at addressing and promoting telehealth from the field based on first responder and EMS response to both emergencies and in connection with community paramedicine programs?"
Yeah, so it's actually interesting. We're working on a project right now that is taking our iPads and putting them into ambulances so that so that those paramedic teams can be better supported. So while they're in the field, and a lot of it is not just supporting those, paramedics, but it's also supporting the patients the paramedics are seeing,
Mm-hmm.
so that the paramedic doesn't need to bring them back to the hospital. Maybe there are things that could be done in the field
Exactly.
under doctor supervision, where that paramedic could then, treat the patient and they're done, almost like a house call, right? But usually these are a little higher level acuity type of things that paramedics are dealing with, almost like a house call. And then the paramedic can go on to their next visit instead of going to the hospital and suffering from what we call wall times, where the paramedics sit there while they're waiting for their patient to be seen. So there are definitely programs that are looked at solving this type of issue. The thing I like to also look at is there's a continuum of care that hits us not only with first responders,
Mm-hmm.
not only at home, but in schools, right, in
Oh, great
workplaces.
point.
And so
Yeah.
how can you extend and use telemedicine to actually attack all of these different geographic areas and place space issues to basically resolve them and tie them into, again, a broader continuum of care. But another thing that's been happening is there's a program out there, to enable telemedicine with great cellular broadband called FirstNet, which is, I believe, an
Oh,
AT&T initiative that's out there. So, there are things like that and infrastructure that's been putting in place so that these first responders can get better support from the base station or from, MD teams.
good points. The next question comes from Brian Smith. Do you believe the current popularity of telehealth is due to the pandemic, which we discussed? Will health practitioners and patients prefer telehealth over in-person care post-COVID-19? And I know we spent a lot of time addressing that, but I'll give you the floor, Jamey.
I'll hit it really quickly, which is that what we saw with COVID-19 was visits initially spike, and then
Hmm.
as the healthcare system started to open up, telehealth visits have gone down a little bit. People are like, "Oh my God, the decline of telehealth." Well, it's not that, folks. What
Yeah.
it is us adapting to whatever this new normal looks like. And I used to run an ER business, and that company is basically, those ER companies are taking a much more structural approach now where they're saying, geez, maybe we need to integrate digital into what we're doing so that these patients that don't want to come into the ER, we still have a
Hmm.
mechanism to serve them. And people think that might be 20 or 30% of the visits that used to be in hospital may not come back. So
Ah, okay.
as we look at that, it's a question of load balancing the healthcare system and putting patients, matching cost to acuity, and giving patients the
Yes.
appropriate care for whatever their condition might be. And telehealth can be that first front door prior to escalating to that in-person visit. And so I think it's here to stay. There's a lot of sayings that people use. You can't put the toothpaste back in the tube, or the genie
Oh,
back in the
yeah.
bottle, or the cat in the bag, whichever one it is that you guys choose. I'm sure there's other ones out there that the audience could share with me that I hadn't heard of. I think it's here to stay, and we're just going to continue to see it grow.
Yeah.
And at some point we'll be back, in whatever the new normal is, past these COVID peak levels into what is a new normalized, digitally enabled healthcare system.
Yeah, and it seems like, in this country that the great advances, like in computer technology or like in telehealth, they've been born out of but out of a crisis, a need that we have to resolve. Um, the next question is from Richard Walpow. I hope I pronounced your last name correctly, but his question is, what do you know about forward deploying hardware to support effective telehealth visits and mobile providers incorporating applications to support the telehealth visit?
Yeah, so there's a lot of different models that people have been using here, and one was during COVID monitoring, right? You have a patient, they've tested COVID positive, but they don't need to be in the hospital, so you want to send them home. How do you enable
Hmm.
them with monitoring tools? Do you send them to the home? Do you, with support of how they work with videos and a call center? A lot of hospitals have opted for we have your telemedicine RPM tools right here. We're going to help you pair them with the phone, and then go home from that. In terms of deploying them that way. So there's not. I would tell you the industry is still figuring it out, what the best methodology is. There have been a
Hmm.
lot of kind of rapid innovations that have happened there. There are companies out there like Vivify Health, who
Hmm.
was acquired last year, who really get how to do this well at scale. And so, I think a lot of it's going to be mailing people a package. For me, a lot of it's also about making these devices a little more engaging. Like, can we make it cool to be healthy so that people want to track this stuff, and that these become somewhat lifestyle devices, and then being healthy becomes a lifestyle choice.
Exactly. Good
Yeah,
point.
to that degree, I think that we're going to be seeing a lot more of this, and mobile providers incorporating apps to support the televisit. I mean, that's happening today. You can download hundreds of different telemedicine apps to help support these visits.
Exactly. And these physical devices, not making it where you need a degree in engineering, but they
to
are
to run
user
them, yeah.
friendly. Exactly. So the
Yeah, I mean,
next,
as a guy who was
yeah,
wearing an Aura ring and a Whoop on my wrist and trying to figure out which one's better and which one tracks information differently, I'm kind of like the Chuck Yeager of some of these devices. I just try them out to see which ones I like.
yeah, that's this one is from John, and he says, how do you distinguish between implementation and adoption of telehealth? How exactly would you define the two, and how do you leverage unstructured data?
All right, so implementation versus adoption.
Yeah.
So, quite simply, it's like having a number of hospitals contracted versus a number of hospitals using the platform. Adoption can
Mm-hmm.
be measured by engagement rates. One of the problems I think that telemedicine had before was that telehealth had been implemented, but
Mm-hmm.
not adopted. And that's because you had, one of the
Great
things that people
point.
used to say about home visits was that, well, God, why are we paying for these telehealth platforms when only 1% of our member base is using them? Right? When you're talking to a payer and they were using American Well or MD Live, like why wasn't utilization higher before? So you had implementation, but not a lot of adoption. I think some of that adoption's been, solved via COVID, and again, people building muscle memory with how these platforms work. And clearly, if you speak to companies
Yes.
like American Well and MD Live, their usage went through the roof.
Mm-hmm.
And a lot of credit and kudos to them on, being able to
Yeah.
scale with demand in what was unprecedented times. So that's really how I would run through and define it. I think we're going to see much more adoption. I think
Mm-hmm.
most people don't realize that telemedicine's been used in the hospital market forever with telestroke, telepsychiatry, et cetera. I mean,
Ex-
saves hundreds of
exactly.
thousands, if not millions of lives a year because of telestroke and those types of applications. So, I think we're going to start seeing, more implementation, but also more adoption.
Yeah, and it just to add on what you said, it's been my experience using AI and machine learning in in those areas. Um, one last question we have from Desmond Brown. Mobile medical imaging, providing X-rays, ultrasounds, and cardiac studies at your location, nursing facilities, private homes. Um, uh, so, how would telehealth support those areas?
So, it's kind of funny. Radiology, they're kind of the OGs of the telemedicine world, right? To use some slang. They were some of the first people to be using telemedicine to do subspecialty reads, to do night call. You had Nighthawk that was out there who, was a firm in Australia that was reading films here in the United States overnight, right? Due to the time change and doing backup. And radiologists soon discovered that if they were going to grow their practices, that subspecialty reads were a key part of that. And so how do you do that? You do that with file sharing, image sharing, and running it through like that. So a lot of radiology companies, their backbone is telemedicine, and most people don't
Yeah,
realize that, but that's
exactly.
really the way it is. And so a lot of respect for what radiology has done to really push the telemedicine industry forward from that perspective. And with integrations like, Box.com and Dropbox and a few other people, they actually have DICOM
Hmm.
readers built into them so that patients can see their films at home and do those types of
Hmm.
things. I think that
Yes,
proliferation of
good
that
note.
is only going
Hmm.
to get bigger.
Exactly. Well, we have about 60 seconds left. I just want to say, Jamey, it's been a great hour. I really enjoyed it with you. And let me just say that for the questions we could not get to, uh, please contact OSB, send an email uh, in order to get your question answered. But again, Jamey, thank you for taking time out of your schedule, for giving us great insights, particularly driven from innovation of your technology. So I hope many of you or all of you that attended this webinar found useful information. So be sure to visit osblabs.com to learn more about the healthcare industry. This is where you can send your unanswered questions to, and basically you can subscribe to receive updates on our up and coming webinars as well. These are a series of webinars, but again, I'd like to thank everybody, and most importantly, Jamey, thank you. I've learned a lot from you.
Well,
It's
Nick, thank
it's
you for
been
the
an honor.
Yeah, no, thank you for the opportunity. We've definitely had a far-ranging discussion. I could talk about this for 5 hours.
Oh, yeah.
So if anyone wants to engage with me afterwards, you can do that at Jamey Edwards on Twitter or hook up with me on LinkedIn, and I'm happy to spend more time answering questions as well.
Great. Well, everybody, again, thank you for your time. And Jamey, most importantly, thank you for your time. Take care.
All right, everyone, stay safe out there.